guys, welcome to Join Iron Maggie. Let's talk about gynecological specimen collection. Okay, in this video we're going to talk about pap smear, visual inspection with acetic acid, and high vaginal swab. So pap smear and visual inspection with acetic acid are screening tests to detect for cervical cancer. So pap smear is a test done to detect for precancerous cells at the cervix. Okay, specifically the squamous-columnar junction, and the squamous-columnar junction is the junction where the squamous epithelial cells of the vagina meet with the columnar cells of the endocervix, and that is the commonest site for cervical cancer. So in pap smear, cells are taken from that junction for investigation at the lab to detect the precancerous cell. Who is eligible to take pap smear? According to the Center for Disease Control, the American College of Obstetrician and Gynecology in 2024, individuals who are 21 years and above are supposed to take pap smear regardless of their sexual status. That means whether you are sexually active or not, you've got to take a pap smear. However, individuals that are less than 21 years, even if they are sexually active, do not necessarily have to take pap smear because their risk for getting cervical cancer at that particular age is reduced. I hope you get it. But what's the frequency? Frequency for pap smear is every 3 years. When you get a negative result, you take every 3 years. However, we have HPV test, which is the test done to detect the human papilloma virus, and that test is also we take cells from that same junction. However, the test rather tests for the virus, not cells that has changed. Are you getting it? So in the event where an individual is doing the HPV test alongside with the pap smear, then the frequency is every 5 years. Either than that, when you are doing only pap smear, the frequency is 3 years. Now let's go to visual inspection with acetic acid. So visual inspection with acetic to re-examine the cervix, but this time around we are going to do it using acetic acid. We use 3 to 5% of acetic acid. We apply at the cervix for 1 minute. Then we observe for what we call the aceto-white areas, color changes. So you will see that if there are precancerous cells, they are going to have white patches at the cervix. Okay, then that gives you a positive visual inspection with acetic acid. So it's the same as VIA. If you are 21 years and above, you can't take a visual inspection with acetic acid. Okay, now let's get to high vaginal swab. Look at the name, high vaginal swab. So this one we use a swab. Okay, a swab to take cells or specimen from the highest part of the vagina, the part that is close to the cervix, okay, for investigation to know the exact organism causing an infection. People that are eligible to take: for anybody having unusual vaginal discharge, anybody having vaginal infection, candida, bacterial vaginosis, any form of vaginal discharge, you can take the swab. Okay, again, if somebody has an infection that has deferred treatment or recurrent infection, you may do gynecologists can order a high vaginal swab where we're able to detect the exact organism causing the infection, and it's also followed with a sensitivity test. So at the end of the day, we get to know the organism, we get to know the antibiotic that can that is sensitized to that, which can take care of the infection. Thank you for listening. Continue to like the page, follow, and share with your colleagues. Enjoy your day. Bye.